My name is Dr. Rachel Young, and I am from Mount Vernon Nazarene University. I teach in the social work department, and I am going to talk to you today about trauma therapy, specifically focusing on adults. I have a lot of experience working in trauma. I worked at child welfare for a long time. I've done private counseling. And in my private counseling work, a significant majority of my client population did come from a trauma background. And so that is what we're going to talk about today. So I want you to think about what you know about trauma. What is your understanding of trauma? It's something that we talk about a lot now, I feel like. We're aware of the role of trauma to some degree, but I don't know how much of us truly understand trauma and understand the day-to-day impacts of trauma and how to be helpful for individuals who are dealing with trauma. So I'm going to share a bit of my experience, some information, and just some things I found to be helpful over the years. So the agenda for this session is we are going to talk about what is trauma, and then we're going to look specifically at the impact upon the brain, because that really then is going to guide assessment and therapeutic techniques and the psychoeducation that we might provide. And so then I'm going to go through some assessment strategies. How do you make that differentiation? Is something, clinical depression, or is it trauma fueling the depression? Is it, generalized anxiety disorder, or is it trauma fueling the generalized anxiety disorder? So just something to kind of think about your understanding of trauma, how maybe you've seen it. Very often it is misunderstood or misconstrued. In my years of practice and working with individuals in the mental health field, I was often the advocate and the voice to say, but have you talked to the client about their trauma? I understand that they seem manipulative. I understand that they seem incredibly anxious. I understand that the work you're doing doesn't seem to be effective, but have you gone to their trauma? Do you understand the interplay of their trauma with maybe the clinically significant symptoms you're seeing, but what is it stemming from? So that is what we're going to hopefully walk away from this session today with, is a better understanding of trauma, the impact on the brain, and then how to use that to inform our work with clients. So to start, ask yourself your awareness of trauma. How comfortable are you working with trauma? How comfortable are you understanding the role of trauma? And hopefully you'll find something that will be helpful throughout this session. We're going to start with a video. It's called How Bodies Store Trauma, and it is from the author of The Body Keeps the Score. It's a fantastic book. If you have an interest in working with victims of trauma, I suggest you read it. The one caveat with YouTube, there are commercials. So I will do my best to try to get through those as quick as I can. But just hang in there with me through the commercials.
Trauma is so ubiquitous that if you think you have never seen it, you have not looked. We meet people who fly off the handle. We meet people who shut down. We meet people who are very difficult. It is a rare family that doesn't have a drug addict, alcoholic, disturbed person. One thing I like to say when I give a lecture, are there any normal people who come from normal families in the audience? And sometimes one or two people raise their hands. I say, can I please come to your family for Thanksgiving? Because I've never been to a normal family. My name is Bessel van der Kolk. I'm a psychiatrist, neuroscientist. I have been studying trauma for about 50 years now. I've treated a whole variety of different traumatized populations, see trauma in many different countries around the world, and I am the author of the book, The Body Keeps the Score. It's important for people to realize that not every mental health professional knows what we're talking about here. The mainstream system of psychiatry, psychology is that there is something wrong with you and I need to fix you. That's a very different attitude than dealing with trauma. Around that time that I first started to work for the VA, a group of us started to define what trauma is and started to define what happens to people. 1978 was the year, and the Vietnam War was over by about 6 or 7 years. The very first day that I met Vietnam veterans, I was just blown away. They kept referring back to to their dead comrades. Their hearts seemed to be with the people who were no longer around. They had a hard time loving their wives and girlfriends. They had a hard time being in any way meaningfully involved in the present. These were guys who were my age, who were smart and competent, but they clearly were just a shadow of their former self. And what was also really striking is they were sort of passive much of the time, and then people told them something that was disappointing, and they went from 0 to 10 and blew up and became extremely angry. Something seemed to have happened to them that made it very hard for them to modulate their responses to the environment. My colleagues and I started to think about how is what these guys suffer from different from what other people who are in psychiatry textbooks suffer from. So I dug up a book that was written in 1941 by Abram Gardner, who had been working with World War soldiers. He writes, these guys suffer from a physioneurosis. Their bodies continue to re-experience that very terrible, frightening situation, and that event keeps coming back in terms of images, behaviors, and physical sensations. So that became the core of our definition of PTSD. We write, these people have been exposed to an extraordinary event that's outside of normal human experience. And in retrospect, that shows us how ignorant and narrow-minded we were, because it turned out that this is not an unusual experience at all. Trauma is actually, unlike what we first thought, extremely common. 1 out of 5 women in America has a history of sexual molestation. Even a lot of men have histories of sexual molestation. 1 out of 4 kids get beaten very hard by their parents. 1 out of 8 kids see physical fights between their parents. People usually think about the military when they talk about trauma. But when we started to work with inner city kids, the amount of trauma that these kids experienced was just unspeakable. The nature of trauma is that an experience enters into your ears, into your skin, into your eyes, and it goes down into a very primitive part of your brain that automatically interprets what is going on. Is this dangerous or is this safe? An event becomes traumatic when there is nothing you can do to stave off the inevitable, and your body starts automatically going into a state of fight, flight, or collapse. The lingering effect of trauma is that you continue to react to mild stressors as if your life is in danger. And so you tend to become hyper-reactive. Somebody may irritate you in the supermarket. You may develop road rage. You may have a difficult time putting up with misbehavior from your spouse or your kids. And most people actually are barely aware or not aware at all that their reactions that they're having right now are actually rooted in experiences they have had before. That event itself is over, but you continue to react to things as if you're in danger. So the big challenge of treating trauma is how do we help people to live in bodies that feel fundamentally safe? The tradition in mental health is to dismiss the reality of people's lives. For example, it's only in the past few years that people are beginning to talk about the impact of poverty, or the impact of racism, or the impact of unemployment. And people have sort of been labeling people, oh, there's something wrong with you, let me fix you. But if you go to a physician or a mental health practitioner who doesn't understand that, they're going to try to fix you with drugs or cognitive behavioral treatment to not do these crazy things anymore. It usually doesn't work very well. What was very clear is that being in a relationship where people can hear you, where you can talk about how badly you feel, where you can talk about your guilt, and where you can start opening up where these feelings come from, how old these feelings are, and how you develop these feelings in response to particular things that happen to you, that was actually quite helpful. Because you need to really develop a deep sense of, this is what happened to me. This is what I'm dealing with. And I need to take care of the wounds that I'm carrying inside of myself. This issue of self-compassion and really knowing that your reactions are understandable and are rooted in you getting stuck in the past is a terribly important part of beginning to recover from trauma. Most of us are survivors of one thing or another, some much worse than others. And so if people say, what do you wish your legacy were? I say, I want our society to know about trauma and to really do all the things that are necessary so that people who grow up under extreme adverse conditions can develop a brain and a mind that can help them to become full-fledged members of society. That's our big issue, and that's the big challenge that we have.
Okay. So hopefully you're able to pull out some things from that video. When I think about, he starts with the idea of normal families, normal people. There is no such thing. That's a phrase I would often use with clients. I would say, okay, normal isn't real, right? It's what we define what we think is normal and appropriate. I mean, yes, there's some societal norms and things, but depending upon your culture, that's going to look different. But it's normal is where we want to try to take out of our vocabulary, often working with clients. We want to norm certain things. So helping them understand that their responses are appropriate given their history and understandable. Doesn't mean we want to keep those responses, but there's at least a framework that makes sense. Very often people who come in to see a therapist who are dealing with significant trauma history have a really, really poor sense of self. Relationships aren't safe, people aren't safe, choices aren't safe. Often there's a lot of like shaming or victim blaming that they're going through. Even maybe others around them aren't doing that. They themselves potentially will be doing that. Where I should have known better, I should have been able to say no, I should have stood up, I should, all these I should haves. And so that creates a really poor sense of self and self-esteem. And then often they will struggle to have confidence, struggle to kind of engage in relationships and engage in experiences because there's such a negative sense of self. And so a lot of times we can help them understand trauma as the foundation. A lot of that gets better, that, maybe they might have a low sense of self from their trauma history, which then fuels into depression or fuels into anxiety. A lot of times the depression and anxiety will get better because they've worked on their sense of self and it's not their fault, or it's not their fault that they're still struggling, things like that.
Get
So
smart.
the next video is we're going to watch, that's the last video for this session, is we're going to look at the impact on the brain. I would have in my office a printed picture of a brain, and I would have that conversation with my clients about what is the sections of the brain, what comes from sections of the brain, how do they regulate the brain? And many said to me, I have never heard this before. We've known about trauma, we've known about the impact of the brain for a very, very long time, but there are so many that still do not understand the physiological impacts and understand what's happening in their brain. And so they think something's wrong with them. They should be able to control themselves better. They should be able to control their responses. They're a horrible person. And when we give them the understanding of the brain and what trauma does to the brain, they give the framework and a foundation to help them understand, okay, I can do something to make a change so that I can have a biological change in my brain, which then can help me as I respond to others. So we're going to watch this video. It is from Media Co-op, and it's about trauma and what it does to the brain.
We need to take a statement so we can establish what happened on Saturday night.
What time did you get back to David's flat?
What time? I don't know.
Can you give us an estimate?
I don't remember.
Would your pals remember what time you left the club?
He seemed nice.
She didn't remember much, did she?
I know. And now we've got to waste more time on a daft lecture. We know how to deal with victims. We've had years of experience.
Well, some of us have had more years than others.
I'm in my prime, I'll have you know.
That'll be right.
Today's session is about trauma. The latest in brain science will help you in your work. I'll start with a tour of the parts of the human brain. The reptilian brain maintains basic bodily functions. The limbic system is also instinctive. It deals with fear and pleasure. For example, you pat a dog, it senses pleasure, and without thinking, wags its tail. The neocortex is the site of logic, imagination, planning and control. It's more sophisticated, but because it's conscious, it's slower than the older parts of the brain. The amygdala is a key part of the limbic system. It has one job, to sense danger and set off the alarm. When it's a matter of survival, the primitive parts of the brain override the conscious part. There are 3 possible survival responses: fight, flight, or the one that people don't think of, freeze. When the alarm goes off, blood and oxygen are diverted to muscles, adrenaline floods the body, and all systems that are not crucial to survival are switched off. Normally, the job of the hippocampus is to file memories so you can retrieve them later, but in times of danger, it stops filing memories, which makes it harder to gather evidence later on. Instead, the hippocampus switches to pumping cortisol. What's useful about cortisol is it stops us feeling pain, so we can focus on survival. Can anyone give me an example?
A farming accident where a man carried his own arm for a mile without feeling any pain?
Yes, excellent example. It is an evolutionary safety mechanism which is fast and instinctive. In essence, it's our body's very clever way of protecting us. To recap, an example of the 3 parts of the brain working together. You're standing at a bar. Your reptilian brain is keeping your heart beating. You're enjoying the pleasure of a nice pint with your limbic system. You're using your neocortex to work out if there's time for another before the last train. What could happen to make the amygdala kick in? What if this happened? The way you'd respond would depend not on your logical brain, but on your instinctive brain. Being glassed in a bar would be a traumatic experience. Who can give me another example of an event that can cause trauma?
War?
Rape?
A car crash?
Good, yes. Trauma occurs when a person is overwhelmed by something beyond their control. The survival brain takes over the rational brain. It can lead to post-traumatic stress disorder, PTSD, with symptoms that last at least a month. Vicarious or secondary trauma is something you may experience if you deal with incidents such as rape or sudden death, or think of Lockerbie, Dunblane. You're not superheroes. Having a brain makes you all vulnerable to secondary trauma. It's important to understand that when trauma occurs again and again, it can become complex PTSD, such as in domestic abuse or child sexual abuse. The alarm system in the brain becomes jammed. Memories are stuck in the limbic system, so a trigger can set off the alarm. The trigger could be anything: a colour, a smell, a sound, a sensation. Now, the indicators of trauma. What should you be looking out for?
Depression. Crying a lot?
Yes, that's one response. And at the other end of the spectrum, total numbness.
Nightmares? Flashbacks?
Stress.
Good, yes. And they may feel sick. Also, shame, feelings of guilt, inability to enjoy sex, social isolation, triggers. People often feel overwhelmed by the symptoms of trauma. This can lead to using alcohol or other drugs to block out memories, or self-harm, or dissociation when a person's mind detaches from reality. Indicators can be specific to the type of trauma. Say, dental problems, when someone who was orally abused avoids going to the dentist. A victim of abuse might bond strongly to her abuser. This is known as traumatic bonding, or Stockholm syndrome. And jumbled up memory, when a person's normal recording of memories doesn't work. Can you recall any times you've seen that symptom?
What time? I don't know.
A traumatised person may not seem like her usual self, or may be hypervigilant, on edge, or being startled by everyday things. Everyone is different. You never know what impact trauma will have. Symptoms can change from day to day. So what does all this mean in practice, in your job? A traumatised person's brain is protecting them, but that normal human response of self-protection can get in the way of evidence gathering. The US military has developed new trauma-informed interviewing techniques that you can use to work around this. Research shows that if someone seems vacant, they could be distracted by their traumatic memories. Try to ground them by asking a simple, non-patronising question such as, "Are you thirsty? Do you want a glass of water?" This can help bring them back to the here and now. Don't expect a logical, linear story. Ask, "What can you recall just now?" Find out what the victim physically felt or saw. Working this way, from the instinctive sensory parts towards the logical parts of the brain, you'll get more results. In conclusion, 4 things for you to take away. Trauma response is the brain in survival mode. Repeated abuse can make trauma symptoms worse. In response to trauma, people will behave in unexpected ways. Remember, trauma is a normal human response to abnormal events.
We know that you've gone through a really painful experience, but we need to take a statement to understand what happened on Saturday night.
Are you able to tell us anything that you remember about his flat? Anything at all?
A dog. Barking.
Are you able to remember any physical sensations or feelings that you had?
Cigarette smoke. I can smell it now.
What was going through your mind?
I couldn't understand it. I just couldn't move, or even scream.
To freeze is a perfectly normal response. So you start with the memories, you don't start at the beginning. You have to engage with feelings to get to the facts.
Makes sense. Check you, Professor, getting all sciencey on us.
Well, if it gets us usable evidence.
There's life in the old dog yet.
Oi.
Okay, so clearly that was focused a bit on, police investigation and how do you change your interview process. But you think about, and we're going to talk about this here soon, about assessment strategies. In many ways, we're doing an interview. We're asking them to share incredibly deep and personal experiences with us that they may never have shared with anybody else. And so making sure that you take the time to pay attention to where they're at, look for the signs and symptoms that their trauma is triggering them, and give them really good education on what their symptoms might be, their behaviors, if you will, the getting angry, having short, irritable responses, really helping normalize that for them, and taking it very slow, knowing it's going to be not a linear progress and a linear story they're going to tell, but it's going to be kind of back and forth, and things will kind of come out, and at times maybe they don't expect them to come out. So really having a lot of patience as you work through that. So let's talk about assessment strategies, things that you want to really keep in mind as you are doing an assessment and working with a client. And remember, you may see a client who comes in for depression or anxiety or ADHD or anything, a mood disorder, but then when you meet with them and you do some work with them, in time they may begin to share their trauma with you. And so letting the client lead what they want to share and how they want to share. A lot of times, you go back to that first video you watched about the concept of trauma is only abnormal things that happen very rarely. That used to be our frame, and now we've begun to realize there's more trauma than even we've recognized. And so a lot of our clients are going to be in that same frame of mind where, well, no, it's not trauma. I mean, yeah, my parents, this, that, and the other, but I mean, That was everybody's parents. And so they don't always give credit to the impact. And so it's how they, how they're responding to the trauma. And trauma is not the same for everybody. So someone's situation may be more traumatic to them, or somebody else in the same situation may not respond as it's trauma. And so really individualizing it and providing that normalization for the client, letting them lead as they tell their story. Don't push too hard, too fast. Really give them time and space, take it slow, and be willing to jump around as they kind of move from situation to situation or situation to situation. Really, really take it slow. And as you go through it, you want to make sure that you focus on regulation. And so it's not just emotional regulation, it's physical regulation. We can get really, really good at, we focus on the brain and we forget about the body that's connected to the brain. So you think about working with adults who, say you're in a traditional office setting and they're sitting on the couch and you're sitting in the chair and they're telling their story. That length of time of sitting without any movement, without any good stimuli to the brain, it could be hard. And so being willing to say, hey, why don't you just stand up for a second, walk across the office for a minute or two, and sit back down. Sometimes that's helpful to regulate our brain. Using smell, there's a lot of things we can use to provide that regulation. Using breathing techniques like box breathing. So you think of the shape of a box. And so you breathe in, you hold it, you breathe out, you hold it, you breathe in, you hold it, breathe out, hold it. And so they do this a few times, say in the middle of a session. And that might help them regulate so they can keep talking about their story. And they may say, hey, that's all I can do today. A lot of people are going to push themselves further than they probably should when we are asking questions and doing assessment with them. Sometimes you'll have clients come in and it's just the whole story comes out. Sometimes it comes out in little tiny bits for a while. Don't be afraid to go back to the assessment, go back to your diagnosis, go back to what you're working on to say, am I working on the right thing? Because trauma hides in a lot of areas. So be willing to give it another good look and have that conversation with the client of, hey, maybe this is stemming from this trauma in your history instead of, maybe you thought it was coming from this scenario. Especially when working with adult clients. Adult clients, they have to be functional in society or, they're kind of expected to be. So hold a job, raise a family, pay your bills, do all these things. And when they feel like their trauma is impacting their ability to be successful, that negative self-esteem, that negative thought process really, really gets into them. And so really working to, we're not saying it's okay to never pay your bills. It's okay to, scream at your husband or your wife or your children, right? What we're saying is, let's give you some understanding of what might be going on, and then how can we change it? Just because you're an adult doesn't mean trauma magically goes away. And really take it in really tiny, small steps, because it's a hard process. Put yourself in your client's shoes. It is hard to share that story, to trust somebody with that story, or stories. And so really, really take small steps and try not to interrupt them. Let them tell their story the way they need to tell it. And say, oh, well, of course, that's clinically normal to have this response, right? Instead, really, really individualize it to your client. And so once you have a really good assessment, you begin to understand the foundation and the history that is influencing their day-to-day, then that can fuel you into what therapeutic techniques might be beneficial to the client, things that you might find are helpful. So really, really doing a really good assessment is important, because that then is the golden thread that you weave through your work with the individual. Some skills. I mentioned box breathing. When someone is struggling though with a trigger to their trauma, telling them to breathe is usually the least effective strategy. When someone is maybe having a panic attack or really anxious or really stressed, you go, just breathe. You need to just take a breath. Usually those words don't really mean a lot. And in fact, they can be triggering and escalating to the individual. Because you go back to what happens in the brain. If someone is responding from a baser level of their brain, okay, the prefrontal cortex, which wasn't covered in video, but the prefrontal cortex up here, first off, that doesn't develop until, like mid-20s. But then second, this is completely frozen if they're down in the reptilian portion of the brain and the amygdala. And so this is in cultures, they don't have access to it. And so if you have a client you're working with who is responding from their reptilian brain, from the limbic system and the amygdala, you're not going to be able to just say, take a deep breath, and that's going to, pop them out of that stressful response. In fact, it's going to be counterintuitive for the client. And so this is where you want to think about some of the other sensory skills. Things like smell, like bilateral movement, like music, things like that can really work on the senses and help regulate the brain in a way words do not. Words are up here, right? The prefrontal and the neocortex, right? That's where we process words. And so we've got to go lower in the brain's function to really meet that need. Usually you want to go like the same level or level up to try to regulate the lower level, to really try to help them calm down their responses in their brain, realize they're safe. There's a difference between known safety and felt safety. And we may know they're safe, but their body doesn't know that they're safe. And so we want to work to where they have felt safety. So deep breathing and box breathing is a fantastic skill. It is usually a skill that has to be utilized and taught before they're triggered. Because if we wait until they're triggered, it doesn't generally, it's not very helpful. And really teaching them how to communicate when they're able about a situation. So they may be with their child out and about, and there's all these noises and stimuli that's triggering them and taking them back to their trauma, and their child starts having, a temper tantrum, and they lose it on their child, and they feel horrible about themselves. And it's not necessarily, it was the trauma history that triggered it, but a lot of times their threshold has been completely depleted. So they don't have that emotional reserve. I describe it like an emotional bank. And so they're putting these deposits in their emotional bank, and then they have this that makes this big withdrawal. If they don't have enough deposits in that bank, that withdrawal is going to take them negative. And so really helping say, okay, this is the context. And so instead of it, you're a bad parent because you did X, Y, or Z, right? Instead go, okay, what was your day like? How are you feeling? What were your emotions in that moment before that happened? And usually you can hone in on the fact that, okay, there was a lot of noise and there's a smell that smelled like, my perpetrator, or, and then these things will pop up and go, okay, so those are my triggers that escalate me. And I was trying to pretend like I was fine. And we are really, really good at pretending we are fine when we're not, because a lot of people with trauma, right, see this as like a non-traumatized like wavelength. And so someone who's on traumatized wavelength will be way up here, right, maybe in this like hyper arousal, constantly on, like we talked about with repeated trauma. And so they'll be up here and they think that they feel like this is quote unquote normal. And so then if anything else comes up, right, it's really easy to escalate just a little bit further. Because if you're all the way down here, right, you've got a lot of range to go before you escalate to that extreme. And so really giving that understanding of you're running hot the whole time, but it feels normal to you, but you're always on. You're always in that fight, flight, or freeze. That's why maybe you're tired, why you're always anxious, why, things like that. And so then let's try to bring that down so that you have a little bit more reserve to deal with things that might come up. Smell, senses are really, really impactful to help us deal with trauma, help us regulate our brain. And smell is something that can be very triggering and very calming. Smell is one of the senses that we just respond to. So it'll come in the amygdala and we will just respond to it. Most of our sensory input will come in through the amygdala, it gets filtered through to the brain to say, hey, do I care about this? Do I not care about this? And we say, no big deal, right? We send the signal back down, say, yep, it's fine. It happens very quickly. And then we move on. But if it goes in the brain goes, this is an issue, right? Starts sounding the alarm, then we're going to respond and we're going to shut down the brain, send everything to the extremities, send the cortisol, send all these things to help us respond. And maybe we don't need to have such a heightened arousal to that situation, but that's just how our body is responding to it. So we can have these triggers from sensory stuff, but we can also have a calming or regulation effect. And so really helping clients think through what are some strategies we can use that are close to that, like amygdala, the reptilian brain, that give us pleasure and sensory input in an appropriate way. So you think about drugs and alcohol, things like that. I mean, that's going to give that pleasure input, but that's not the strategy you want to go toward. So you want to look at things that are helpful, like taking a walk, getting, going outside for a few minutes, um, putting some lotion on your hands of a smell you like and just, right, giving it a nice, good, deep breath. So you're accomplishing two things. You have that smell, but then you're also getting that deep breath that's going to regulate the system. And when you work with adults, you want to think about how this is impacting their day-to-day life. So, for example, maybe they're at their job, and because of the stimuli at their job and situations that are happening, they're escalating at their job and they're at risk of losing their job. So, a lot of them are going to want to look for kind of low impact, low entry strategies that I can still do at my desk, or I can still do in my office, or I can, still do. I don't have time to go on 17 walks in a day. And so that's where smells and bilateral body movement, some of those things can be really helpful. And we'll talk later about preemptive planning, but I'll mention it briefly here. The idea of getting ahead of it. We're really, really good at pretending we're fine, we're fine, we're fine until we're not. That is too late to deal with whatever the trigger is or whatever the trauma is, right, that is escalating us. So pulling it back and going, wait, hold on. If you are realizing at, just before the staff meeting, your heart rate goes up and your breathing gets shorter and your hands get clammy, then you need to do something before you go in the meeting. Have something you can do maybe 3 times throughout the meeting to provide that ongoing regulation stimuli rather than waiting until it's too late, essentially. I would describe it as if your amygdala has gone off, it's kind of like a nuclear reactor that went off, and you just got to wait for the dust to settle before you can respond. And it's the same thing. It doesn't change once you're an adult. That still happens. And so we want to try to keep that nuclear reactor quiet so we can function and do the things that are important to us. So music is really good. That auditory stimuli, especially if it has a very rhythmic beat, then that's going to help give some regulation to the brain. So if someone's sitting at their desk, can they every so often just listen to a song that's very rhythmic that helps provide that regulation? Because that then helps with both sides of the brain work together. You have that rhythmic kind of bilateral input. Same thing with movement that's bilateral. When you use both sides of your body, you have bilateral movement happening, that can be very regulating to somebody. So things like walking, doing squats, those are types of things that can be very regulating because it helps regulate across left and right from the brain as well. The logic and the reason versus the emotion. So it provides a whole brain regulation. A lot of times people can't necessarily get out every hour to walk around their office or, things, but I tell them, think about maybe go getting some water every hour, things that, you can do in your office study that aren't going to look weird to the person or feel like they're drawing attention to themselves when they take those breaks. Things like having them even just on their legs in their meeting, giving bilateral input to their legs by rubbing both thighs equally. So they can rub both thighs to provide some of that stimuli that's regulating. So really becoming inventive and creative of how they can incorporate this in their day-to-day life in ways that don't draw attention to them, but also provide that regulation. The preemptive planning I mentioned, a lot of times individuals are aware of their triggering situations. A lot of times they're not. So we want to help them identify their triggers. That's often where we start is what are your triggers? Like you had maybe this situation explode, but let's go all the way back to what is the original trigger, right? So like maybe they exploded at their husband, but it really comes back to they were at the grocery store and that's when they started feeling tense because they smelled cologne and it smelled similar to somebody who hurt them, right? So we got to go all the way back. Or like they were at the store and a Christmas song came on and it reminded them of a situation that happened. So we want to go back to what is the original trigger? And that can be hard. And it's usually packing layer by layer by layer. Once we get to what the triggers are, that gives us a little bit of idea of what can we plan ahead for. It's not going to be perfect, but we could try to plan ahead. So if maybe large crowds are triggering, then having to think about, before I escalate to the point that I have a panic attack, or before I escalate to the point that I can't, communicate, saying, hey, about what point do you find, how long do you feel like you can be okay before you realize, oh, I got to get out of the room? Maybe say 20 minutes. Okay, great. Every 15 minutes, I want you to go get a drink from the drinking fountain, step out in the hallway, go to the restroom. I said, Would you rather them think you have the smallest bladder in the world or feel like you're going to escalate and lose control? And so get ahead of it. That's like that preemptive planning. So get ahead. Maybe the auditory stimuli is so intense. Like they can be around the people, but it's the sound, right? Maybe too many people in a room. Maybe it's echoing, things like that. And so saying, well, everybody has AirPods in their ears now. Why don't you stick AirPods in your ears? It's not that you can't still have conversations with people, but it dulls a little bit that stimuli to a point that you can navigate it. Um, so really thinking about strategies that don't call a lot of attention to them, because trauma is usually a very quiet thing internally, right? People don't generally want to share their trauma. Um, and so really helping them think about how they can plan ahead and do some strategies that are going to regulate them, hopefully. Most find when they plan ahead, it's usually more beneficial. We tend to be very reactive instead of proactive. So we want to shift to that proactive perspective. And really try to, before that escalation happens, take those breaks. And so then we begin to help identify the physical signs of that stress or traumatic response. So, their hands are getting clammy or sweaty. They're realizing they're clenching the hands, they're tightening up in their shoulders. So help them do a body scan to say, hey, when you start to realize you're clenching your jaw, that's your cue to take a step away, regulate yourself, and then come back. So really building that education around that, and helping them learn how to have a conversation with loved ones beforehand about what their needs are. So if, say they're going out to dinner with a friend and they know the restaurant's going to be loud, they may say to the friend, hey, the restaurant gets a little loud, so I'm just going to, about every 10 or 15 minutes, I'm just going to take a few seconds. Nothing's wrong. I just want to take a few seconds to just get out of the sound for a few minutes and I'll be back in. Um, and so that there's that conversation. It's not wrong to share what your needs are and to ask for them. And so being willing to do that. And that's usually very hard for clients, but really helping them, how am I going to have this conversation? When am I going to have this conversation? Practice a conversation so they can build a comfort level with that and be realistic. Someone may need to go back to the site of the abuse and the trauma, and some do not. Some need to talk with a person again and, have some level of closure and healing, and some do not. The abuse and the trauma often happens through relationships, and so often there's that healing through relationships. But really having a realistic conversation, a realistic expectation of not going to just go in tomorrow because we want it to. This may or may not be a strategy that works for you, and being willing to have the client tell you, yeah, I'm not going to go to the bathroom every 15 minutes. That is too embarrassing. That will cause me more anxiety. Say, okay, let's think of something else, right? So let them direct and lead and be realistic with what's best for them. Not everybody wants to journal. Journal is a great tool, but for example, some may need journal prompts instead of a free flow journal. Some say, I'm never going to use it. Then that's not a strategy you give. So really being realistic and having that honest conversation with your clients of, okay, so let's talk about journaling. And they go, no, it's great. And we're not going to even have that as an option. And really providing that normalization, providing a lot of psychoeducation on the brain, on the impact of trauma, on helping them really understand that they're not the only ones who've been through trauma, and they're not the only ones who are struggling with the responses to things because of trauma. And that's not to minimize their experiences and their trauma. It's to really help create some connection, like you talked about. The first movie talked about when they are in groups together, they can talk about their feelings and their emotions, and that kind of shared reality that others have experienced trauma too and are responding the same way. That can really create a sense of normalization, and that negative sense of self, that really poor self-esteem can get better because there's an awareness of, I know why this bothers me and I know what to do about that. I understand this history and I know what to do about that. I can think of a story I heard about someone who was in a restaurant after coming back from the war, and a plate broke, back in the kitchen. And before that person even knew what was happening, they were under the table. And everyone at the table was like, why are you down there? And they kind of like slunk back up, right back on the table. But that plate breaking sounded like a gunshot. Nobody else heard it because everybody else, right, plate breaking, Or, most are going to be okay, right? It's not even going to trigger because it's going to get set through the amygdala, prefrontal cortex, and go, no big deal. Someone just dropped a plate. Tell the amygdala to chill out and then move on. Before this person can even logically process what happened, they were under the table. So that's an example of how quickly the body is going to respond to triggers and stimuli and things that take us back to our trauma. And so really normalizing that for a client, helping them understand what happened. They're not going to be able to prevent all of those situations, but how can we help you understand that sequence of what's happening and try to minimize that for you? So that's where the psychoeducation comes in. It is so important to really give good education on what is trauma, how does trauma impact the brain, how they can work through this, how there's not something like eternally wrong with them because they have a history of trauma, and that it's not this linear path. People may be doing really, really good and something will happen and they're going to kind of feel like they fall back from their progress. That's normal human responses. Normal, right? There's that word again. But there's just that normal response of things happen. People have triggers. We can make really good progress and maybe we didn't get enough sleep or we didn't eat enough. And so then we're more aware of the triggers and we're responding more quickly to triggers. So really pulling back these expectations to a more realistic set of expectations. So most people do not really understand how much of their day-to-day experiences are rooted in their trauma history. So you take a couple and say the couple is, had an argument and the one spouse says, then I'm not coming to Thanksgiving dinner. And the other spouse has a really, really emotional response. And you don't love me and I can't count on you. And so say that they've been through abandonment as a child. So even just that phrase of, I'm not coming to Thanksgiving dinner, it doesn't mean they're leaving them. It doesn't mean they're not going to be in the relationship anymore. But to them, it goes straight to the heart of, I can't count on you because you're not coming because you're going to abandon me like everyone else. That's not necessarily the thought process they have, right? But that's right where it goes. And they might have a emotional gut response from that experience. So helping them understand, okay, and once they can understand it, right, then they can, once they regulate, look at that and go, okay, they're saying they're not coming to Thanksgiving because they're upset. They don't mean it. And even if they don't go to Thanksgiving, doesn't necessarily mean, right, this, that, or the other. Calm down, let them calm down, and then we can have a conversation about that statement. And so there's a lot of things that can happen where it looks one way, right? When we get down to the heart of it, it's really rooted in trauma. And that's why they responded the way they did. And so pulling it back and helping them make that connection, this is where cognitive behavior therapy can be helpful, but we're not fixing the trauma, right? We're trying to help them navigate it and manage it. So it's important to help normalize their responses. Obviously, I'm not going to normalize perpetuating trauma, perpetuating abuse, but we could also provide that education of you were abused, so now you have to learn how to function differently so you don't continue the abuse. So we can help them understand that cycle, then how to make different things. So normalization is not approval of responses or approval of behavior. It's more, this is an awareness, understanding of what's happening and why it's happening, and then how we can work with it. So you think about, and I'll use the analogy of, say someone tells you you have diabetes. That means your pancreas isn't working right. So therefore this is happening in your body. And they go, okay, then you want to take the medicine. It's that same idea of, I'm not saying it's fine, your pancreas doesn't work. I'm saying, let's understand what's going on and how can we respond to it. So try to take away any guilt associated with either trauma or responses, and instead focus on manageable strategies. Instead of, why did you respond that way? Say, okay, let's talk about why you respond that way and then what can we do about it? So my final thoughts, I want to bring back the point of realistic timelines. Trauma didn't happen overnight, especially repeated trauma. So if you're talking about complex trauma, especially complex developmental trauma, where it was multiple times throughout, their growing up years, that's going to influence their attachment and their relationships and their engagements and, things throughout their rest of their life. And so you want to have this realistic timeline of, you're not going to fix it in a day, probably not even a week or a month. And you're going to think things are great, and then you're going to have a time where you fall back. So really being realistic. Don't be pessimistic where you take them down and say, you know, you can deal with this for forever. But instead have this really take that pressure off of the client to say, hey, it's going to take some time and that's okay. And I'm going to walk this path with you. So final thoughts to take away, trauma looks different for everyone. So really individualize it to your client. And a lot of times it can take longer to navigate than like quote unquote traditional diagnosis, right? If we're talking about a chemical imbalance in the brain, and someone gives them a antidepressant and it fixes it, great. They come to counseling, they deal with X, Y, or Z, they feel good, they move on, right? It's different. Trauma is this kind of longer pervasive thing. And it can resurface without warning. So really focus on skills that think about bilateral body input, rhythmic sound, sensory input, things that are really going to help regulate that brain and help them think about how to be proactive and then identify triggers early so that they can kind of work to respond to them ahead of time and have better responses and really set realistic expectations. Oops, sorry, wrong direction. So if you want the references, if you want to get any further information, this is my information and the university I'm at and my email. So feel free to email me if you have any questions. I'm happy to share information with you. Thank you so much for taking the time to do this training. I hope you have a wonderful rest of your day.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.